Olá, muito bom vê-lo aqui novamente. Sou Leonardo Giusti, sócio-líder de Infraestrutura, Governo e Saúde da KPMG. Hoje temos aqui Rita Ragazzi, a nossa sócia-diretora, líder de Health, Anna van Poucke e Michael, ambos do time global. A Ana é nossa líder global de saúde e o Michael é o Global Executive de Saúde. Vamos falar sobre um estudo que a KPMG globalmente patrocinou, realizou, que é o KPMG Horizontes da Saúde. Esse estudo visa trazer insights, tendências sobre a transformação da saúde, considerando tecnologia, jornadas e mão de obra, workforce. Então será um prazer tê-los aqui acompanhando essa jornada conosco. A gente vai fazer em inglês, em benefício, obviamente, dos nossos visitantes, e pretendemos fazer aqui algum tipo de interação, então fique com a gente por esses próximos 15, 20 minutos. Anna, nice to have you here. Mike, welcome to Brazil. So let's talk about KPMG Horizon study. Just to begin, can you please contextualize the global study, the healthcare horizons, and what is the main takeaways and lessons that we can take from this study?
Yeah, I think actually the initiative for the study started a couple of years ago when we surveyed 200 CEOs worldwide in 8 countries. And one of the questions we asked them is there a need for transformation? Now, we did this during COVID, so we were all thinking that COVID was a crisis and was giving a need for transformation. However, one of the questions that we asked was, is there a general need for transformation? And when we asked that question, 80% of all the people that we talked to said, we need a major transformation of all service delivery aspects in the coming 3 years. So what we saw there, and from the questions and the answers that we got, there is a huge need for transformation in healthcare. Healthcare is in a huge crisis worldwide. I can see that on all my travels, long waiting lists in the UK, in Sweden, in Saudi Arabia, and everywhere where I come, waiting lists are very long, or service delivery is getting poorer. And so what we wanted to do is we wanted to have a clear view on what do we need to do to get out of this healthcare crisis? What are the different aspects that we need to be doing? And I think one of the major key takeaways is that if we keep doing the same things as we were doing and just add a little more, so add a little bit more money, have a little bit more workforce, pay a little more, a little more wages, we are not going to solve the problem. And what we're actually going to create is a healthcare system where not all of the population can have services, or where waiting lists are so long or quality is so poor that it's actually impoverished. The second finding that we had is if we're going to rely only on technology is, by the way, very important to get to the solutions, but relying only on technology means that we're going to serve the digital literate part of the populations, the part that have devices, but we're going to leave behind the not so digital literate, or the people who don't have money for devices. So the major key takeaway, healthcare needs a very radical transformation, and it needs a very radical transformation that touches 3 aspects, also in connection to each other. We need to invest heavily in digital and technology. We need to invest heavily in workforce and enable them to work more digitally supported. And we need to invest heavily in what we call activated and engaged communities, so we can help communities and to take care of themselves and change the dial from curation to much more prevention-based systems and much more systems that are based on monitoring and very early intervention. So these are the key takeaways.
Interesting, very clear three pillars of focus, right?
Yes.
People, technology, and how to make it work and engage in the communities.
That's it.
I think I would add something that healthcare hasn't traditionally been very good at is the ESG element of things. Healthcare has a huge responsibility for health. Socially, healthcare contributes more than any other sector, but there's the environmental sustainability that is creeping up now in healthcare, more regulation coming down the line. It's something we need to start thinking about. Healthcare, if it were a country, it would be in the top 5 polluters globally. So it's a huge issue. There's a huge amount in healthcare supply chains that contributes towards climate change and global warming. It's something that needs to be on the horizon. It's something we need to start taking a lead on as a healthcare sector and dealing with in the near future.
Yeah, very interesting comment, Mike. Yeah.
Tell me, can you summarize a little bit, Anna, of what were the key factors that brought healthcare systems to the place or to the challenge that we are seeing, and what we should avoid in the future for not getting into the same situation?
Yeah, so that's the question. Why did we get into a crisis? So let me make me one thing clear. We all thought that COVID was a crisis, and some people thought that if COVID was over, the crisis would be over. That's not the case. COVID unveiled the underlying crisis in healthcare. So what are we suffering from? I think we're suffering from a number of things that all come together. We're suffering from the fact that populations are getting older. Well, that's not a crisis, that's something that's happening. However, within that elderly population, we're having much more non-communicable diseases. So our living style is changing, and our living style is not changing to the good side, but more to the unhealthy side. So more non-communicable diseases, more demand. We're suffering from the fact that we didn't really invest enough in workforce, and that's both workforce well-being, but also planning and strategic planning. What will we be needing? Also, the pay for some of the healthcare workforce is pretty low, so that's something we didn't invest in. We didn't invest enough in technology, so we have a lot of legacy systems in healthcare. So that's one thing that we're suffering from as well. And then I think a very important point is that the reimbursement systems in healthcare are very much focused on curation, very much focused on hospital care. Our systems are very hospital-centric, so our systems are fragmented. And I think it's that combination of facts which makes it, which makes the fact that we are in such a crisis now. So to be honest, on a number of factors, we've been lagging behind, and we haven't been thinking in general strategic and transformation focused enough about healthcare.
Yeah, I think what you mentioned, that planning and the use of technology, it shows us that we really need the transformation. It goes to your first answer. So what we need to see is that all those waves of shocks, they really need transformation. They need planning and the agile and effective use of technology,
yes,
right?
Definitely so, yeah.
And it's never been a more critical moment to do that. If you look at what's coming down the line globally, we look at recession and the huge amount of COVID-related debt that governments are dealing with, or healthcare systems are dealing with. You look at the potential for climate change, you look at mass migration and geopolitical instability. Healthcare is not out of the woods as far as crises go. COVID is not going to be the only crisis that it has to deal with. There's a lot coming, so it needs to be sustainable and resilient sooner rather than later.
Yeah, sure.
And considering the results of the study, what do you think, Anna, is the future of health under KPMG eyes? And I added an additional question. What about Brazil? And what about the rest of the world? How to get there?
Yeah.
Or be prepared for?
Yeah, I think the answer comes down to the three pillars that we mentioned all the time, but we need to be seeing these things interacting and integrated together. So data and technology, and everything that data and technology provides, is going to be key in healthcare. And a little bit of a fun fact is, when we were producing this thought leadership a year ago, we didn't even talk about generative AI and ChatGPT yet, because we didn't know it existed. So that shows us how quickly the developments and the trends are taking place in technology. But we shouldn't be thinking only about technology in a B2C model, so delivering directly to clients, that's part of it. But we should be thinking about technology. How can we help our staff to be much more effective and have a higher productivity? So we're seeing examples for example, from Israel and from Sweden, where we use technology in combination with a new thinking about workforce, and their efficiency and productivity levels went up to 30%. Satisfaction went up very high. So that's one element. The second element is that we need to integrate data and technology into population and the activated communities. So just imagine a community that gets information all the time about its health status and where the dangers are and where the risks are, and providing primary care and your Brazilian family health teams with this information. They would know much quicker and much better where to intervene, which populations to target, where are the risks. And then we need to apply the workforce, not only, and the workforce strategies have been very much hospital focused, so enough medical specialists, enough cardiosurgeons, enough very high specialized staff. That's what we will need in the future. But what we will be needing much more is family doctors, community nurses, working together with social workers. So it's about closing the gaps between these three elements. Now, when I think about Brazil and a little bit more of the specific situation in Brazil, I think Brazil has a number of very good foundations for the future. So I think your very strong primary care, your family health doctors. I see Brazil in the conversations that I had this week is very eager to move in the digital space. So thinking a lot about digital health, telehealth, new ways of delivering. But a number of the things that we need to be thinking about in Brazil is electronic health records, data interoperability. You've got a lot of fragmentation in the system. So in order for it to be future-proof, we need to close these gaps in data interoperability. Then we can start using the data much better. We need to start thinking much more about what is the staffing of the future. Having, I think, more GPs, more community nurses, but also thinking about workforce in the future. How can we work on the uneven distribution of workforce in the Brazilian healthcare landscape with, underserved areas and areas that are much better served? Using technology also to support workers in the field, in the remote areas to do much more. Just imagine a community nurse working with augmented reality, knowing much better what to do, having the data, having support. And I think the last thing that you need to be working on much more is population health and using the data that you can collect from your system, not only the electronic health record data, but also different data sets on income, on lifestyles, on pollution and things like that. And using that to make the activated communities much more based on population health interventions. So that are a number of things, and I'm forgetting a lot. I mean, I think also moving the needle from hospital-centered care to primary-centered care, setting up your reimbursement system, which is now fee-for-service. It's very much curation-focused, very little prevention focus. It's very much focused on doing a lot of interventions in the hospitals. That reimbursement system needs to be changed as well. One of the elements, by the way, that we see very successful healthcare systems doing, and which will be a way forward to the future, is public-private partnerships. I think one of the most important stepping stones for the future of healthcare in Brazil is forging public-private partnerships between public providers and private providers. But when I talk about that, I also talk about ecosystems where startup comes in, where technology firms come in, where data providers come in. So it's thinking about the public-private partnerships and forging a much more stronger base in the ecosystem that is serving the population.
Yeah, very interesting, because at the same time, healthcare ecosystems are unique for each reality, each country. Challenges are the same across the world. So everything that you mentioned, I'm guessing is a common situation in many countries. So I guess the opportunity we have here is how to learn and leverage solutions, right? So not trying to build our own solution, but scale up solutions that have been built somewhere else.
And learn from other countries. Brazil is, to be honest, the 6th continent that we are visiting in 6 months. And it always keeps amazing me how much comparabilities there are, how much similarities there are. And that means that we can, you can't always copy them all the way 100%, but take the learnings and take the underlying techniques and start implementing it. And we had a very good conversation last Sunday with one of the very big providers here. And we said, go and visit Israel, go and visit Finland, because there are exactly the examples that you will need to go towards the future.
Okay, Anna and Michael, in terms of KPMG, how we have accomplished to move forward in digital health and patient journey? How can we help our clients in move on and add value to their healthcare systems?
So quite a lot of the work that we do is around redesigning patient journeys. A lot of the work that we do in integrated healthcare systems starts with redesigning patient journeys. And in the years, more and more, we're integrating digital health there. So we do that in a number of ways. We use a lot of data to redesign care pathways, because you get data on what is the size of the population, differentiation in the population, but also what works and what doesn't work, being a basis for redesigning healthcare journeys. Patient journeys are very much redesigned in integrated systems. So a huge example is where you come from, the UK, where they're working much more with integrated healthcare systems. And we redesign care pathways and moving away the focus from secondary care to primary care. So keeping patients longer out of the hospital, or even treating them totally at home, or having patients being dismissed from the hospital much earlier, and then giving workforce the data and the tooling to help them at home. So that's one thing that we're doing. I think another one that is very important, and I know that in this time, margins of healthcare providers are very much under pressure. We're using a lot of data and digital tooling to do analysis about, like, are the referrals right? Are we using our capacity in the right way? For example, we're doing a very large program in Norway where we analyze the whole operating theater, and we factor in the no-shows, and we factor in the fact that the surgeon comes in too late, or the anesthetist, or something is not ready. And by doing that and by using that data and our digital platform, we are increasing the efficiency to a much higher level. One of the things that we find is very important in KPMG, and that we're doing more and more, is we're one global firm. So we have much more interactions and communications in place, where, for example, we have a very new way of working in Norway, like with the operating theaters. We can bring that solution to countries like Brazil. We redesigned care pathways in some of the islands and bringing that to other islands. We did a whole program in British Columbia on improving the care pathways and improving the efficiencies in oncology, because waiting lists were incredibly long. Now, if we've done it in Canada, we can transform that very easily to countries like Brazil, apply it here, and that way we can help in making our clients learn from the best and the leading practices worldwide.
And I think you're absolutely right. There's that top-down, here's the experience of what we've done globally, here's what our 5,000 people have been doing in 70 different countries around the world. But there's also that bottom-up bit. There's also engaging with patients in your specific health system, in your local area, to really start to understand, well, what are your pain points? What are the problems that you have? And then we can work with them then to solve them.
So if I would summarize and pick the main ideas, is that we can integrate and make the patient journey more fluid.
Yes.
And bring efficiency to the systems, and look to the diversity of the world and bring the best benchmarks that fits Brazilian market, right?
Yes, definitely. Yeah, definitely.
Yeah, very interesting. Now, I think, Anna, you touched on my next question as well, but I want to see a little bit more about how the public and private can work together, considering the three key pillars you mentioned, and how we as a citizen can play a relevant role in this equation as well.
Yeah, I think, and I'm first we'll have a short global look, and then I will have a look at Brazil. I'll take one example, India. India has achieved enormous amount of improvement in healthcare. They had about 30% of universal health coverage for their population in 2019. They now have up to 75% of health coverage. India has about a population of 1.5 billion. That's immense. However, if you cover for healthcare consumption, it also means that you need to have the provision and you have to have the providers. Now, that is something that is very hard to achieve. So what India did very good, they had a private sector. They are now working in a partnership between public and private, using a full capacity. That's one thing, but also using the efficiencies and the lessons learned in the private sector to apply them to the public sector. But for primary healthcare, for example, they're setting up a lot of private primary healthcare clinics because it's easier to address, it's quicker, it's more entrepreneurial. So what we see globally is that the public-private partnerships are very important, You have to have very good contracts there. So the thing that you want to prevent in partnerships is one system benefiting too much from the other. It really needs to be a two-sided contract where the private sector, for example, can benefit by growing more, by providing more, by growing more, but where the public sector can benefit from it because they become more efficient, they can use the innovation from the private sector. So that's what you have to put together. I think here in Brazil, the public-private partnership is very important. First of all, I think it's important in terms of capacity. We know that waiting lists in the public hospitals, public providers are quite high. Can you solve that by using private capacity? Can you solve problems by exchanging workforce? Can you solve problems by using, if private has the investment money to invest in digital health, can you then apply that to the public sector as well? And at the same time, can you have the private sector grow by keeping it, by taking out some of the backlogs from public? I think one point that's what I noticed these days, that there's quite a thriving startup community and quite a thriving community of medtech. Pharma, medtech, life sciences is quite big in Brazil. Try to work on these innovative public-private partnerships there as well. Try to use as much as possible what medtech companies are developing. And by doing that, try to shorten implementation times so that you can benefit in Brazil as one of the first in the world of new solutions that are being developed. So I think public-private is very important, and I think in Brazil you can really benefit from doing that.
Yeah, I see your points, but I think, and I want to challenge one thing: interests and incentives.
Yeah.
Now, I think in order for us to move forward, we have to align interests and incentives.
Yeah.
So, you have any comment on this? I'm sorry tough question.
No. It's not. I think it's a very just question, and I think, as long as you stay working with a fee-for-service system, especially a very strong fee-for-service system for the private sector, and more grand block budgets for the public sector, where the block budgets don't really cover the costs, you're going to have inequalities. The moment you start working with capitation fee, the moment you start working with value-based contracts, which are sometimes based on population groups, funding population groups or funding episodes, and the moment you start doing that for public and private together, you're going to integrate the interests much more. And especially if you do that when they work together, they then start having common interests. Just imagine that you say, okay, this is the population group. Now public-private in this region, together with primary care and medtech, start working together to deliver care to, let's say diabetes, let's say obesity, let's say hypertension. It's your role now to improve health and outcomes for this group and lower the costs at the same time. And every money, all the money that we save by doing that, we're going to push back to you, and you can invest it again in innovation. That's when you start having the interests together. So yeah, we need to work on the reimbursement systems there.
Very interesting. Thank you.
Wow, my next question is all about this. So how do you feel that in Brazil, you have been a lot here in meetings and talking to the people, talking to clients. So how do you think companies and governments should think of the future of healthcare in Brazil?
Maybe I'll ask that question to my colleague at first.
Thanks. I think we have to go back to the original principles of healthcare horizons. I think there's a huge move towards primary care, towards empowering communities and individuals. Brazil's already moving in that direction. The work with the family care groups and the family care teams is really, really important. I think in the context of Brazil, where there is a significant level of inequality between those with private and those with public healthcare, I think empowering them with the data that we mentioned, with the interoperable systems, with an improvement in things like telehealth, that's going to have a massive impact on population health, a massive impact on outcomes. So I think that's going to be your starting point. I think investing in the data, that's going to be absolutely critical. So I think people have this idea that this is a really big, scary thing, but actually it doesn't have to be. And I think a lot of the technical ways that it comes out is very simple. I think of examples of places where they do have well-integrated data sets. You'll see a primary care doctor in the morning will get a list of people that live in their area. It'll be risk stratified. So the people at the top of that list are going to be the ones that are the highest risk of flu or of other simple problems. And they'll go out, they'll use the teams to reach out to those people. That's the kind of thing that in Brazil could happen soon with a bit more investment. I think the other thing is workforce is absolutely key. You need people to deliver that. You need people out in the communities, you need people in primary care, and you need a plan. If you don't have a plan, things don't just fall into place. We're seeing that around the globe. We're seeing a lot of, I take the NHS where I'm from, there's been a huge emphasis on developing a long-term workforce strategy because we can't poach nurses and doctors from other countries forever. It just isn't working around the globe. We need to have a longer-term vision for how our workforce is going to look in the future and how we can start to plug some of those gaps right away. Anna, anything to add?
Yeah, I want to go back to India again because India is, being one of the BRIC countries and also being a very large country and a relatively young nation, I think there are some comparisons. So one of the things what they're doing in India with this major transformation of their healthcare system, they're taking one collective slogan, and that is a healthy society. And that healthy society is being seen as the responsibility of everybody. So everybody starts working together under that umbrella of the healthy society. And just imagine if you were doing that in Brazil and you know, governments, companies, providers, insurers would all say, okay, but what you're doing is that contributing to the concept of the healthy society. And I think we need leadership. You have leadership, but we need that leadership to converge to one point. And that point could be something like health is wealth, the healthy society, health in Brazil, and working together towards that. That's, by the way, a very important role for the government as well, to help everybody go in that direction. And then check, are our reimbursement system going towards that? Are our data systems going toward that? It's the way in which we have, in which we structure primary care and secondary care. Is it towards that? Are the PPSs going towards that? So I think that collective leadership, I don't believe in a very strong competitive model in healthcare. In countries where we have strong competitive systems, I don't see a lot of people benefiting except for the ones that need to have a lot of money and need very complex procedures. The systems that are the strongest are the systems that are working towards that overarching umbrella. So I think that's something that I think is very important to Brazil as well.
This is interesting. Yeah, it's a different way of looking at that. It's not so common for us to put on the table to discuss. Yes, for sure.
Well, that has been a lovely conversation, but I'm sad to say that this is the last question. And it's about IoT, artificial intelligence, and other ChatGPT and other technologies that will be available in a few years or so that we never imagined that we'll be able to access. But how can we apply those technologies, accelerating the future of health? Not only managing data and managing population healthcare, but also delivering when we have countries like Brazil that's very large in extension, but very in terms of distribution of wellness and point of care, very, very different depending on the region you go. So how you see that?
I think actually it's crucial to improve health and also improve health equity. So I'm looking at a number of countries that have some different difficulties in providing healthcare to remote areas. So some of the African countries, I know that one of the African countries, it's Rwanda, that's working with a whole digital platform for the country, providing primary care. So that's the Babylon platform, where a lot of primary care can be provided digitally by logging in by your phone, having your remote monitoring. Actually, phones can do more and more in terms of remote monitoring. What is really remarkable that they're covering already 33% of the population in the remote areas by doing that. So that's beautiful, and that's the way forward. Another country is Finland, where they're actually working on hybrid systems where digital and physical is integrated, but where they're not only using that in a way where you address and you help patients directly, but they also have a lot of e-learning modules where you can help providers and workforce, health workers in remote areas to serve the population. So just imagine a field worker in a very remote area here having the connection to a central team, to a central tower, using the IoT devices to do measurements, and then with the glasses on, getting recommendations and instructions. This is what you have to do. But also getting e-learning modules like, this is your population, this is what we see happening here, this is where you should be focusing. So I think that whole Internet of Things, generative AI, ChatGPT can be crucial in that. There's one big but that I want to state there. We need to work on the trust of these systems. There is, of course, they have huge advantages. They have the risk that if they're not the right systems, or if they're systems that can be hacked, or systems that can be corrupted, we're going to be in a lot of trouble. So, and we also need to take care that these systems are serving principles of health equity. So not only serving a few of the population. So that's where we think that we need much more regulation, where we need much more collaboration between industry, governments. I think also parties as KPMG, we have a lot of experience in providing trust in these fields, working with the providers together. So that trust and the auditing of these systems and the regulation around it is going to be a very important point.
Yeah, I mean, it's said that algorithms are biases written in code. So I think you're absolutely right, Anna, that the cybersecurity angle, but also the equity angle are both absolutely crucial there. And we are seeing, I'm glad you mentioned ChatGPT, we're seeing a version of that used already in generative AI in Israel, where it's being used to support primary care doctors with decision making. So information's being pulled through from a number of sources in the electronic medical records. That's then being combined with what's going on within the room, which is being recorded by AI through voice recognition. And then there's real-time analysis being done by the generative AI, suggesting to primary care doctors, do you want to maybe ask this question? Maybe you should think about this. Perhaps this is something they're experiencing. So we're already living in that future. I think on the flip side, thinking specifically to Brazil, you can't get to that future if you don't have standardized data, if you don't have your electronic medical records in a good state, and you don't have full interoperability between your different systems. So you really need to start addressing those things. That's absolutely critical. And then I think, you just say, Anna, making sure that we're moving forwards into that future where things can be totally different, but we're doing so in a way that's responsible, that protects our patients, and that improves their outcomes at the end of the day, and improves the life of the workforce as well.
Yeah, definitely so. And I think one last element is that if we were to apply it in the right way, we need to think about integrated ecosystems as well. So think about health field workers, primary care, and then secondary care, and then all working in the same chain of command and working together, and the field worker being supported by the medical specialist from the hospital, or the primary care doctor working together with the field worker. So it's about integrating digital in your system, working especially on the principles that Michael was just saying on, interoperability and equitability, but also creating that integrated system. So I think a future without integrated ecosystems is going to be very difficult. And in the integrated ecosystem, digital and new tooling, IoT, generative AI, ChatGPT needs to have a place. So there's going to be, I call it the marriage between man and machine. In the future of healthcare, we need to think marriage between man and machine.
Very interesting point of view. So just to finish, final remarks, Rita, Anna, Mike.
I think it was great. Some central points that you mentioned, that is planning, the use of technology. I really liked your two examples that technology can be democratic. So you mentioned Finland and Rwanda. So we need integrated system, but it doesn't need to be expensive out of rocket science. So this is central points that stays to me after this chat that we had. Yeah, thank you so much. It was a pleasure.
Thank you both.
Thank you. It was a lovely conversation. Very kind of you being here with us today. Hope to see you soon.
And thanks, Brazil, for having us.
Yeah,
always lovely to be here.
Yeah. Thank you.
Obrigado. A gente termina aqui esse bate-papo com a Anna e o Mike, com a Rita, sobre KPMG Healthcare Horizon, um estudo global da firma. Espero que vocês tenham gostado.